When we receive requests for information from patients, it is essential for us to understand whether these patients can actually come in for a visit or not, whether they have the right symptoms, the right condition. So one of the first questions we usually ask them is exactly this: what condition are we talking about? Because we mainly treat Parkinson's disease. But we also treat post-stroke events as well as neuropathies. So once we have established that it is one of the conditions we treat, we try to understand what the symptoms are. Because when we talk about Parkinson's disease, if the motor symptoms that we treat are not yet present, it might be too early for the patient to decide to have a first session, since they would not see any kind of benefit. As I was saying, the symptoms we treat are the motor ones. So we're talking about slowed walking, shuffling gait, dragging of the feet, difficulty changing direction, as well as episodes of freezing of gait in a somewhat more advanced stage of the disease, difficulty maintaining balance and stability, and motor block. We also treat muscle rigidity. It is enough to have one or two of these symptoms to decide to try the therapy. If the patient is suitable for the treatment, the response is immediate. So this means that just a few minutes after the session, still in the doctor's office, the patient already has the opportunity to see if there is an improvement in these symptoms. The sensation that the patient experiences in response to the treatment is having lighter legs, a freer, smoother walk, a longer stride, much less muscle rigidity, and above all, if there are episodes of freezing of gait, there will be a marked improvement both in the frequency and in the duration of these episodes. As for the process to determine the patient's suitability for the therapy, an initial session is conducted to see if there is a response and if the treatment provides any benefit. 2 or 3 days after the stimulation, I contact the patients to find out how their experience at the center was, whether they actually had a positive response following the stimulation, which symptoms they noticed improvement in, and how long this benefit lasted over time. After that, we assess together the possibility of carrying out this second session, because if the result of the first session was positive, to be truly certain of the patient's suitability for the therapy, we want to perform this second treatment. During the second session, in addition to the stimulation, we also perform a 3-dimensional scan of the patient's feet, which is useful in case the patient later decides to proceed. There is no obligation to purchase. It is the patient who decides, precisely based on the benefits obtained, as I mentioned. Sometimes it happens that I talk to patients who are unsure about trying the therapy, not because of the therapy itself, but because of the distance. I put myself in their shoes and explain that if I had any doubts, I would still invest some time to try it.